Good evening, I'm Marla Porter. Former President Joe Biden is diagnosed with cancer. Today, his office described it as an aggressive form of prostate cancer that has metastasized to the bone. Local 12's Chris Arnold spoke with a urologist about what this means for the former president. Chris.
Well, Marilla, Dr. Stephen Kappa is the vice president of the urology group here in Cincinnati. He says prostate cancer is the most common form of cancer in men, adding that 1 in 8 men will be diagnosed with it in their lifetime. Now, Dr. Kappa says despite the former president's diagnosis being a serious one, there are treatments available.
We don't want to sugarcoat things. So I would say this is very serious.
Dr. Stephen Kappa is the vice president of the urology group in Cincinnati. He says he sees prostate cancer every week in his practice.
In former President Biden's case, it sounded there's two things going on. He presented with obstructive urinary symptoms, it sounds like. So he actually was having difficulty urinating. They found a prostate nodule, and that's what led to the ultimate diagnosis.
The former president's office says he was diagnosed with an aggressive form of prostate cancer on Friday.
Group 5 disease, which is the highest risk disease. You know, a small percentage of men will have aggressive, and one way to think of this medically is stage 4 disease.
And that it has metastasized to the bone.
That means that you have a local organ, in this case the prostate. The disease can get out of the prostate and spread to other organs, and in this case it's the bone, and that's actually very common for prostate cancers.
The release from former President Biden's office did not indicate which bone the cancer is spread to. It did say the cancer appears to be hormone sensitive, which allows for effective management.
The statement that former President Biden's cancer is hormone sensitive is actually really important, because that means our first line therapy, sort of how we start treating this form of aggressive prostate cancer, is still available to him.
Dr. Kappa says that will slow down the growth of the cancer, but it won't cure it.
What will likely happen in his case is he'll do a combination of therapies, hormone therapy, number one, which can be done with a shot or a pill. It's a pretty simple treatment. And then additionally targeted therapies. So even in advanced stages of disease, men can have successful treatments.
Well, Dr. Kappa says big picture, only 3% of men who are diagnosed with prostate cancer ultimately die from the disease. However, he says when you talk about aggressive or metastatic forms of the disease, the 5-year survival rate goes down to 37%. Morella?
All right, a lot of great information there.